we're still ploughing through the season now, not the reporting season, we're doing that too, but the flu season. And it's been a shocker in Australia, hasn't it? Over 400 deaths, I was hearing today on radio. A recent report from the World Health Organization Influenza Centre describing the outbreak as exceptional, quote unquote. 2019 may end up being even worse than the flu epidemic of 2017. I mention this because Australia has one of the most exciting flu vaccine businesses in the world. Seqirus, owned by listed mega biotech and darling CSL. Well, when CSL presented at the Macquarie conference a couple of months ago, they put up this slide. Now, the x-axis scales population and the y-axis is deaths per head of population. And you can see there that flu is basically in the top right-hand corner of the graph there. Not good news. CSL reported its results this last week, and we heard a bit more about its pioneering work on flu vaccines. CSL bought the struggling flu vaccine business Novartis almost exactly 4 years ago and pulled it back into the black under Gordon Naylor last year. And in true CSL style, it's been the investment in R&D that's repositioning the business with a new cell-based flu vaccine instead of egg-based flu vaccines.
And I think this is really the opportunity for us. This is a unique technology. We're the only scaled player with cell-based flu technology. And so I think that offers us some advantages, as well as our flu-ad, which is our adjuvanted flu for the elderly, which, of course, are at high risk for influenza and disease.
And what's the advantage of cell-based over egg?
Well, you don't have to rely so much on chickens, which is, to get those eggs. During the flu season, we will process up to 800,000 eggs per day. And the supply chain there is quite complex. The issue is that if you need surge capacity, that is, so for instance, in Australia, it's a very tough season this year, and people are dying, and it's not a, the flu is a serious disease, and we have to think long and hard about how we encourage people to look at vaccinations. But having said that, if you need surge capacity, that is, you need additional doses of vaccine after you've already produced for the season, it's very hard to order more eggs and have them available to actually make the vaccine. With cells, you're able to replicate those cells in a way that is much faster to actually have the starting cell to grow the strains in. So the ability to ramp up in a crisis mode is better with the cell than it is with the eggs, just because of the lead time and the logistics.
Yeah, interesting stuff. We shouldn't forget pandemic flus as well. We've not had a pandemic since the bird flu crisis a few years ago, which killed a lot of people and created chaos in places like airports. And looking at this graph, it's only a matter of time before we're due for another. Governments are looking at stockpile ordering for antigens, which is also a business for CSL, but that is a rather inexact science. So that's the joyful flu. I should say CSL's overall results this week were darling. Another record high share price after an 11% rise in profit to $1.9 billion US, and another 10% growth in profit outlook for the coming year. And last week, CSL announced that its massive new global headquarters would be in Melbourne, in the biotech hub at the Parkville precinct, even though the bulk of revenues comes from the US these days. Advance Australia.